Sam, welcome to Podcastina.
Thanks for having me, Galena.
Thanks so much for doing the show. I want to start with just the most basic question I can ask you, which is what is ketamine therapy?
Ketamine therapy is the use of the medicine ketamine to treat various mental health conditions. And that can look many different ways depending upon the setting, the intention, the route of administration, and there's a lot of nuance to it. So hopefully we can kind of dive into that a little bit more. But big picture, utilizing ketamine to treat mental health conditions, primarily depression, PTSD, anxiety, suicidality. That's what we focus on primarily at Ketamine Clinics Los Angeles. Those are the most commonly treated conditions. And there are other conditions as well that respond really well to this modality.
How did you get into this line of therapy?
It's always it's a good question. And after 12 years, I still feel like my mind goes in so many different directions when I get that question. Um, I've had my own transformative experiences and my own challenges and transformative experiences with more alternative medicine. And I've also had a lot of friends and family who have suffered and people very close to me who I've tried to support through their journey in dealing with mental health challenges and addiction. People I've lost to suicide in my friend and family groups. And I came to find that even in a big city like LA, even if you have resources, mental health care is not very good. It's not very effective for a lot of people, maybe even most. And it's not because all the providers are bad people or they're not smart or kind, but largely the system is not really designed for healing. And the tools that are available are not really that effective or designed for healing. And I wanted to be a part of the solution. I wanted to be a part of changing that, which was really largely motivated just by my own, trying to solve personal, familial problems.
You talked a little bit about what ketamine therapy treats. So I think a good question would be like, who is a good candidate for these types of treatments?
Yeah, that's a good question. I would say anyone who is dealing with those conditions, who's living with, depression, PTSD, anxiety, suicidal thinking, various forms of depression as well. So we see patients with treatment-resistant depression, which means it hasn't responded to two or more medications. That's the conventional definition. Adequate trials of two or more medications. We also see patients who are utilizing this as a first-line treatment. So starting out with it without having to go down the road of a lot of things that are less effective with more side effects. And bipolar depression, postpartum depression, so, all different kinds. Also OCD, even some substance use disorders, and the list really goes on. But I would say anyone who's living with any of those conditions, who's looking for something that works very quickly, very safely, with very few side effects, and who's looking for more of a holistic kind of a healing approach, would definitely be worth considering this treatment. And we specialize in IV infusions. So that's delivering this medicine in the clinic, ketamine infusion therapy in the clinic under medical supervision. And there are, as I mentioned earlier, there's a lot of different approaches to it and a lot of different settings that people are using ketamine and in different routes of administration. And by that, I mean ways that they're actually receiving the medicine in their body. So oral, like a pill that you swallow, or sublingual, like troches or lozenges that dissolve under the tongue and the mouth, IM, intramuscular injection, intranasal, spray in the nose, and really any which way you can take any medication, you can take ketamine. And there's a lot of nuanced advantages to the IV route in terms of safety and efficacy. And so that's why we specialize in that. So most of what I'll be answering today will be through the lens of what we do at Ketamine Clinics Los Angeles, which is IV infusions. And I would definitely encourage anyone who's interested in ketamine as a mental health treatment to pursue that route, if at all possible, as a first choice. And there are good things with the others, and certain practitioners doing good work and patients getting good results. But IV really is the gold standard for a lot of reasons. And if time allows and you're curious, we can dive into some more of those details. Um, as far as who's not a good fit, anyone who's dealing with schizophrenia, schizoaffective disorder, who's not stable in terms of their medical challenges like uncontrolled hypertension or cardiac issues that are uncontrolled, aneurysm, uh, certain types of severe uncontrolled personality disorders. So most medical challenges we can manage as long as patients are stable. It's okay if they have hypertension as long as it's stable, or, whatever their challenges might be. But it's when things are not stable or controlled that it can be a difficult thing to manage and not safe. So as far as, exclusionary criteria, it's kind of two categories. One is psychiatrically and the other is medically. And there's not a lot, but there are some things, and those that I listed are most common. Of course, being pregnant is exclusion as well, though there's a lot of great results we've had with postpartum depression, and there's a good basis to feel pretty comfortable that ketamine is not likely to be transferred through breast milk, in the fact that it has a very short half-life. And if you space out the timing of treatment and of breastfeeding, there's only one very small study that I know of about that, but the results were very positive, and it was virtually undetectable about 12 hours later, because the half-life of ketamine is about 3 hours. So, even in those scenarios, there's a basis to consider the treatment, and obviously it's very sensitive and case dependent. But yeah, those would be the common.
And do you do IV because the dosing is more accurate than, let's say, like a nasal spray or a lozenge?
That's part of it. So with IV, the bioavailability is 100%, and that's the amount of medicine that gets into the blood and then through to the brain. Also, we're able to increase or decrease the rate during the infusion, because the infusion is an hour long. So it's not an injection or a shot, but it's a slow, gradual, continuous infusion. And so we can increase or decrease the rate during it to deepen the experience or to make it less intense for people. And that variability is really valuable in terms of the peak benefit for each patient. It really is individualized dosing, and it's different not only between patients but from one visit to the next for the same patient. So that ability to adjust it for both their comfort, their safety, and also finding the sweet spot in terms of when they're going to get the best, where they'll be at, and getting the best response clinically to the treatment. You can't do that with any other route. Everything else is a bolus, which is a technical term for basically just a push of all the medicine all at once. So whether you're spraying it in the nose, putting it in the mouth, swallowing it, injecting it into muscle, all of that is just all the medicine in the body at one time. And then also you can't take it out or take it back. And
Mm.
so if something does go wrong medically or psychiatrically, or someone's having a really tough time, you just have to wait. And with IV, again, because the half-life is so short on ketamine and we're giving such a tiny amount continuously, we can actually reduce the rate or even stop the infusion altogether, and that starts to wear off in about 5 or 10 minutes. So very, very precise dosing and adjustment of the experience, and an ability to control it for safety and efficacy that you just don't have in any other way, in addition to the bioavailability. And then the kinetics of it are a little bit different as far as like neurochemically, what's going on in the brain, the experience that people have psychologically on the ketamine during the IV. It feels different. People are able to explore their psyche in a smoother kind of way. So there's just a lot of advantages to IV.
Now, this is a super, super simple question, and maybe I should have even asked it earlier. Where does ketamine come from?
Yeah, ketamine is a synthetic compound. It was synthesized in the 60s. It was FDA approved in 1970. Interestingly enough, it is found in nature in some cases, though that's not the ketamine that we use or that anyone would get would be like a natural or organic form, but it's possible that it is found in nature sometimes. Um, that's something that people kind of use to distinguish it from other plant medicines, as to say it's not as good because it's not natural. But uh, yeah, it was synthesized and it's a synthetic medicine, and it's FDA approved for anesthesia as an anesthetic. And it's been around for a long time. A lot of people don't know that. Using it for mood is a new use, or relatively newer use for this old medicine. But with that is just decades of real world use, even though the use has been a little bit different. We know a lot about it. We have a lot of safety and efficacy data on ketamine as a drug generally. We know it really well and how people respond to it really well. So that gives a lot of advantages that a lot of other newer compounds or um, psychedelics that we're just starting to get the opportunity to study, have. And we're using sub-anesthetic doses for ketamine therapy. So we're using much smaller amounts than are traditionally given. And so patients are conscious and awake the entire time. But they do dissociate. They do have somewhat of a psychedelic journey. And that varies in intensity depending upon the patient and what we're trying to achieve. But, it's generally more moderate. It's not like super intense. And, it can be pretty light for some people. And that's kind of the moving target of that sweet spot of how are we going to help people to have new insights and healing and introspection and, exploring their psyche and their inner world in a way that's kind of removing barriers for them to access material and thoughts and feelings that they don't normally have access to, but without it going too far to where they don't really even know what's going on, right? And so there's a sweet spot there. That's where I like to say, like, the art meets the science. And this is a niche where there really is a lot of an art to it,
Mm-hmm.
and it makes it pretty unique. If a practice is too much into the science, they lose that human element. And if you're too much of an artist, then you're just too woo woo and you're not really rooted in, you can hurt people. So the balance is, having the artistry and aesthetics and the beauty and the energy of something that's very, very personal, and for some even, spiritual and special. And then also being evidence-based and looking at the scientific rigor and the research and the data and doing things that's according to Western medicine models and standards. So we really live in the middle in that world, in the balance of those two. And I think that's important for this, and probably for any treatment, but especially for this and other psychedelic medicines in particular. I think they have kind of a special need for that kind of balance.
It's interesting to me that it's classified, and correct me if I'm wrong, as a psychedelic because, as you're saying, like while it's found in nature, it is synthetically made. Although I guess acid is synthetically made and that's considered a psychedelic. So it's fascinating that these are things that initially were studied by the FDA and went through all of these different kind of checks and balances and then ended up vilified just for people to now be trying to walk that vilification back and be like, no, this actually has a lot of medicinal uses. And I wonder how much of it, maybe this is getting a little conspiratorial, but were the pharmaceutical companies just not on board with delivering it in a way that was like profitable to them? So they maybe pulled some strings behind the scene to make sure that it was uh, painted as just like this party drug and that it wouldn't have these medical uses. Because for me in the past, and granted now I've had some like just the teeny tiniest bit of experience with like seeing it firsthand in the medical field as like a treatment. I was assisting at a ketamine clinic for like 5 seconds when I was living in LA, but before that I had only heard of ketamine referenced to as like a drug for horses or like a club drug. So it's interesting to hear you tell me that history of it because I didn't know that piece of it, that it went through FDA approval. What you said, like in the 60s?
Yeah, and it was approved in 1970. Yeah, most people don't know that. And it is a horse tranquilizer or a cow tranquilizer and used in veterinary medicine. And a lot of people know of it as that, and they think this is crazy. You're giving this animal thing to people, but it's the other way around. Actually, it's very common for human medicines to be given to to other mammals and to be used in veterinary medicine when they're approved as safe and effective. And it's actually that direction from the human to the animal world, not the other way around, And it's also used as an anesthetic, and it is also used as a drug of recreation or abuse or misuse, or however you want to consider it. And then people are also incredulous, like, wow, Special K, that's a terrible, dangerous drug. Why are you giving that to people? Well, this is just a tool. And like any tool, it can be used for good or for bad. It can be used to heal people, or it can be used to harm people. And there's nuance there. And I think in today's world, it feels more and more every day like nuance is just not, it can't exist in any conversation about anything. And it's black or white, all or nothing, good or bad. And people want to like oversimplify any topic. And that's just not the reality of how the world works. There's gray, there's nuance, there's details that matter. And I always say to people, like a hammer, I could take a hammer and I can build a church or temple or build a home with it, or I can beat someone over the head with it. It's just a hammer, and so how you use it matters. And we're utilizing about 1/10 of the dose that people use when they use it recreationally. It's usually about 10 times the amount, and in a very controlled setting. And it's pharmaceutical medicine. It's not, when you get stuff on the street, it's almost always adulterated and mixed with other drugs or copycat drugs or chemicals that are similar and might not actually have any of what you think you're getting in it. And it's safe, it's legal, you're being monitored, we're controlling the dose, it's individualized. And it's just, also the IV route gradually over an hour, whereas in the club, people are often snorting it, usually all at once. So this is not really an apples to apples comparison. And, some people do develop a liking for ketamine and they use it more than they should. But I also want to point out that it's not physically addictive in the way that most other substances are. And that is an important distinction for people to recognize, because
I was going to ask.
With opioids, a lot of people had surgery and they got put on painkillers, and then they just got hooked and they couldn't get off of them. And it was a big problem. And so I think there's this, with the opioid epidemic, there's this fear like, well, what if I go to a ketamine clinic and I get some ketamine for my depression and then I become a ketamine addict? Like, and I understand where that fear comes from, but it's important that people understand some of the pharmacology of these drugs and the differences there. That yes, people can use ketamine as a means of escape, but we really don't see that as an issue for the patients who come to us. We wouldn't be in business 12 years later. We've provided over 35,000 infusions. This just wouldn't, we wouldn't have gotten this far if everyone we were just churning out ketamine addicts left and right. It just doesn't work that way. And nicotine, alcohol, benzodiazepines like Xanax, opioids, many, many other substances do create a physical dependency, in that you actually really have a craving for it, and you can actually start to feel sick, or in some extreme cases, like with benzos, you can actually literally have seizures or die if you abruptly stop taking it after you get up to taking high doses regularly. That doesn't happen with ketamine. And that isn't to say that it isn't a problem for some people. But it's pretty rare, and we really don't see that. Someone asked me the other day, do you have people coming to you who just want to get high? And the answer is no, because it's not that easy to come here. And not all clinics are like this. Some of them, maybe it is easier, but we have our standards as far as the evaluation and the intake process, and making sure that people are medically and psychiatrically appropriate, having consultation and eval and paperwork and assessments and all these things. And then it's also not that cheap. If you just want to go get high, it's a lot faster and easier and cheaper to just go get it on the street. So this isn't really a space, at least in our clinic, for people who just want to get high. It doesn't make sense. So we really don't see that. And, there was one other thing you had mentioned, just as far as access goes and psychedelics. I mean, it's interesting because LSD is synthetic, and MDMA is also synthetic. And people commonly call those psychedelics, but they often will say that ketamine's not, based on what's found in nature and what's not, but yet it doesn't fully compute. And some of the other things that I think people look at is like, well, what's a classical psychedelic versus a not classical? Ketamine is also known as a dissociative anesthetic. So that's another kind of category in terms of what it's like. But there's also the neurochemical processes. So like a lot of them acting on the 5-HT2A receptor in the brain, whereas uh, ketamine doesn't. So there's a distinction there of like what's acting on that receptor versus what's not. But I think ultimately this is a lot of semantics. And, when you zoom out a little bit and you look at, well, are these drugs or medicines, producing a out of body, out of mind kind of an experience that enables you to have mind revealing insight and introspection on yourself and alter your perception of yourself and the world around you and kind of distort your senses in a way to potentially promote healing and discovery? And the answer with all of them is yes. So I think that's kind of the umbrella that they live under as far as what makes them all psychedelic.
I'm so glad you spoke to that because I was actually going to ask, like, is it addictive? Because I think for a lot of people, that's the perception or that's the barrier, and they're not necessarily knowing the details of it and just kind of putting it in a bucket with all those other things. Although people who are more familiar with psychedelics, street ones and therapeutic ones, they know that like you don't get addicted to something like mushrooms or LSD, or if you do, you have like a really significant issue. It's just not the kind of thing that you hear dependency the same way that of course you do about like opiates and alcohol and all of that. So moving on from the
Definitely.
addiction piece of it, something, I guess let's take something specific like depression, since you mentioned that as one of the conditions that's often treated with ketamine. What does the research tell you about like the efficacy of that?
Yeah, so research will show around 50 to 70% efficacy, which is very high. Most of it is based on treatment resistant cases, so even tougher to respond. About one third of all patients with major depressive disorder are considered in that treatment resistant category. And that's a number that I think is an underestimate. And I think you have to also look at the quality of relief. So even if people meet certain criteria for having, responded, um, when you look at the quality, a lot of the time it's pretty low in that they may not feel as depressed, but they also, I'm talking about with, conventional medications like SSRIs, they might feel less depressed, but they don't really feel good either or happy. They just feel kind of flat and in the middle band. And they narrowed the, uh, how broad their experience of life is. And I don't think that's particularly good. And there's also a lot of negative side effects as well, like loss of libido and weight gain, none of which you have with IV ketamine. In our clinic, we see an 83% success rate. And one of the reasons why it's higher is we're not limited exclusively to treatment resistant cases, which a lot of research is. We also offer a little more medicine over a longer period of time, and we individualize the dosing. And so in the research model, you really have to stick with a one size fits all approach because you need to isolate variables and you need to be consistent with what you're doing in order to have, the scientific method work. But we're not a research center, we're a treatment center. And so uh, we have a lot of variability in how we take care of people and really individualize it. And that makes a big difference in the results. So also we utilize an IV uh, syringe pump instead of a bag, and that digital syringe pump allows us to titrate really precisely as well and have great continuity among our dosing, and that also can make a difference. So those are just some of the reasons why our results are better than what you see in the literature.
That's so incredibly high. I love that.
It's pretty cool.
It is. If someone's going in for the first time, how can they expect to feel during?
Yeah, this is always a tough one to answer because it's so individual, the experience. And it, as I mentioned earlier regarding optimum dose, the experience is not only different between patients or among patients, but also for the same patient among or between different infusions. So what you feel or experience on your first visit is almost guaranteed not to be the same as on your second visit because we provide 6 infusions over 2 to 3 weeks. So they're spaced out 2 per week or 3 per week for a few weeks. And there's so many different factors that inform, or impact what kind of an experience you're going to have. That being said, to give you a sense, it's a big range, and it can be anywhere from kind of spiritual or meditative to reflective to happy, or sometimes difficult thoughts or feelings or memories will come up. And people go on these journeys often in their mind's eye. So it's kind of closed eye visuals. So it's not like they're looking around the room and seeing all kinds of crazy things happening in the room. Actually, it's one of the nice things about ketamine is that it's pretty easy relative to other psychedelics to orient yourself, in that, you know, they have an eye mask on or sleep mask and their eyes are closed listening to music, and you can have a lot of things that you're seeing in your mind's eye. But if you ever want to kind of ground yourself or come back to reality for a moment, if you lift up the mask and like look around the room, you realize, oh, okay, I'm at you know, Ketamine Clinics Los Angeles. I'm having a treatment. I'm in the treatment room. Like, you can orient to where you are and what's happening, and with an awareness that if you were on like a big dose of LSD, maybe you couldn't, because you'd just be like so in another galaxy. It's not even like, you don't even know where and what you are anymore. And you know, that could happen with ketamine in theory with really, really mega high doses, but we're not using those dose ranges. So we're keeping people in a place where they can be grounded in that way. And yeah, I mean, everything from someone has, you know, we've seen people cry for an hour straight, but not like in a bad way. You know, when I say that, sometimes people go, what? I don't want to pay all this money and to go cry for an hour. Well, these are people, maybe they didn't cry for 10, 20 years, or maybe they didn't mourn the loss of a loved one, or they haven't been in touch with their emotions. And this was like really healing for them to express that. Right. And we've had people who laughed the entire time, you know, whether it was at the, you know, hilarity of the universe, or, you know, just also just having fun or feeling happy or being in touch with whatever it was that was a release for them. Most people are just laying there and there's not a lot going on externally, but there's a lot happening in their internal world. We've had patients who sang for an hour. We had one woman who used to sing so loudly that we actually had her come in during our office hours when we don't normally schedule patients, because we didn't want her to disturb the other patients. But she had shared that when she was younger, she wasn't allowed to sing and she got in trouble for it. And so, of course, we didn't want to tell her to be quiet. So we were like, all right, you know, I was like, just have her come in when we don't have any other patients in the clinic, and she can sing her heart out, and she would just be singing at the top of her lungs. And, you know, for her, that was just like really therapeutic, you know, for her to express herself in that way and to be creative and to not have her self-expression be stifled. And so, you know, that was like a really beautiful thing for her. So everyone's got a different, you know, experience. I say most people, again, you know, they're not necessarily outwardly emoting, but they're working through trauma in their mind. They're getting insight or clarity or new perspective on their past or people in their life in ways that they are not as emotionally triggered. And then they're able to gain, you know, realizations or put things to you know, make peace with things, or recognize that the stories that they had came up with about who they are, other people aren't necessarily the whole truth, you know, because those events are set in stone and they're never going to change. But the stories that we tell ourselves about the past and what it means about who we are, we can change that at any given moment, right? So there's a lot of clarity that happens there for people, especially with various types of trauma, which we find that most people have some degree of trauma. Right. And for some, it's more front of mind. It can feel more significant or more recent. And for some people, they think, oh, I don't have any trauma, and they're not even aware of it, but that there are things that have really impacted them. But I think most people have something. And so there can be a lot of healing and clarity there without having as much of an emotional response to some of those difficult memories. And yeah, I feel like I'm kind of rambling at this point. I could keep going, but hopefully that gives you a sense of what the experience can feel like.
It does. And I'm curious what someone can expect as far as like physical sensation too. Because if I was there and I was getting the treatment, what kind of heads up would you give me to like call you back in the room and be like, hey, crank that shit up? Like, I don't feel it.
Yeah, that's definitely one of the first things we go over. We say, here's the crank that shit up instruction. No, so especially on someone's first visit, but any visit, we do really stay like tuned into them and how they're doing. And we check in with them on whether or not they're getting enough medicine. So we look at, are you comfortable? Do you need anything? Are you getting enough? Are you feeling it? Are you getting enough medicine? And one of the things that we can do is we do an eye check and we look at their horizontal nystagmus, which is a technical term for this coarse, rapid eye movement that's side to side. And you can see if someone's eyes are kind of wiggling in that way, that they're kind of in the pocket, in the sweet spot. And if you're not giving them enough medicine, that won't happen. And if you're giving them too much medicine, you can actually push them past the point where that stops happening. So again, it's this kind of sweet spot. And that's just one indicator. We don't, live by it, but it's one really great way that we can check on whether or not people are where they need to be. And then also just how they sound, the tone of their voice. You say, are you getting enough medicine? Someone sounds just like clear as when they came in, like, yeah, I don't know, I'm not sure. And they're really present. You're like, oh, that person isn't really altered, But when someone responds and they're like, I think so, and they're like gone, you're like, okay, they're not fully with us right now. So, these are just some of the ways that we measure it. And we also look at the vital signs. We use hospital grade monitoring equipment. So we're monitoring their pulse, oxygen saturation, EKG, and their blood pressure. And you can tell when people are starting to have a deeper experience, oftentimes like their respiratory rate will slow down a little bit, they breathe a little bit more slowly, or maybe their blood pressure goes up a little bit. It's pretty typical for a transient spike in blood pressure during an infusion. Their pulse might go up a little bit more if they're having more of a kind of intense experience. So these are some of the tells that we look at as well. And overall, just like the clinical observation. And patients start to get comfortable with the medicine and what it's like and where they want to go with it. And we welcome their input on what is working or not working for them. So people have a ability to also just say, hey, like I'm not really feeling it as much, or I'd like to go a little deeper. And so we work with them, within reason, to support that as well.
I'm curious what it's doing to the brain that's kind of making all of those good things happen. Because I know with MDMA, and correct me if I'm wrong, that the reason that feels as good as it does is because it kind of like takes the amygdala, the like fear part of your brain offline. Is that also what ketamine's doing, or?
Yeah, I don't know if there's nearly as much activity in the amygdala with ketamine as there is with MDMA, but that is part of it. With MDMA is what's going on. It also just dumps like all of your available serotonin, which is a happy, yeah, neurotransmitter, right? And so just feels really good. With ketamine, it's unique in that it doesn't affect those other neurotransmitters that are most commonly adjusted or impacted with medications like serotonin, norepinephrine, dopamine. It does not really affect those in a significant way, or at least primarily. Its primary mechanism of action is on the glutamatergic system. And glutamate is a neurotransmitter that's abundant in the brain, found in more than 85% of the brain. And all of the other neurotransmitters combined comprise the other 15% of the brain. So glutamate is the most prevalent, and ketamine impacts that through as an NMDA receptor antagonist, as an AMPA receptor stimulator. It increases BDNF, which is brain-derived neurotropic factor, which is a protein that increases neurogenesis, increased neuroplasticity, so new connections forming in the brain, increased dendrite density, connectivity, synaptogenesis. So it's actually, you think of like all these structures in the brain as almost like branches of trees that are actually being plumped up and growing healthier and stronger and thicker and more of them, and actually connecting with one another. And so the signals and the communication among these is improving. So brain function is actually measurably improving. And we see this in animal models and physical parts of the brain, like in the prefrontal cortex, actually plumping up. So it actually, it's not just treating symptoms. And this is one of the things that's so exciting about ketamine and really most, if not all of the other psychedelic medicines, is their ability to actually have an impact on brain function and light up the brain and increase brain activity across the whole system, which is why, or one of the reasons why it seems that these medicines work so well for so many different conditions. And these, I think, kind of two-part. One is a lot of mental health conditions seem to really just be different symptoms of the same condition, which is trauma, and then different manifestations of that and how people deal with or respond or react to trauma in their life. And then the other thing is it's just really like good all around for a lot of different exciting processes that are occurring in the brain. And that seems to just really help everything overall. So it's a pretty unique medicine in that. And also, as I mentioned earlier, other psychedelics are impacting the 5-HT2A receptor, most, if not all of them, as a primary, whereas ketamine is not. And so that's also one way that it's kind of unique.
That's really cool. And the neuroplasticity part of it is probably where so much of that helpfulness and that like efficacy piece is coming from. I wanted to touch on because this is like not current events, but I just saw that there's an update to the case. But I feel like the impact of Matthew Perry's death might be like relevant to this conversation, just because a lot of people saw that, and those who are probably skeptical about it were like, "Oh, see, this is why we can't." Like, from your POV, what went wrong there, and what impact do you think that's going to have on the industry?
Yeah, I mean, this case has like been so front and center for so long now. I think it's important for people to understand that obviously, first and foremost, it's a really sad situation and a sad loss for so many people who are his friends and family and fans of his, and the entertainment community at large. And it's obviously a really sad loss. And that being said, he took more than 10 times the amount that we give in the clinic by himself in a hot tub in combination with an opioid and a benzo, both powerful sedatives, and he passed out and drowned. And then all these headlines ran that he died from the acute effects of ketamine. But he didn't die from ketamine. He died from taking sedatives alone in a body of water and drowning.
Mm-hmm.
And I think it was a pretty unfortunate distortion of what actually happened. Most medical professionals would say if he was in his bed, for example, he would have probably passed out and woken up the next day. And, when someone gets into a car accident and they die because they've been drinking and driving, no one reports that they died from the acute effects of Budweiser or that they died from acute effects of Smirnoff. They say that they died in a car accident, and maybe alcohol was a part of that cause of the accident, but they died from a car wreck. And so I just think it was really distorted. And then they also, a lot of these articles, most of them even, went on to try to make a link between him utilizing ketamine therapeutically and what happened. Saying things like, oh, he had recently had a treatment. It just created a lot of concern and confusion among people unnecessarily. So the treatments that he had somewhere weeks prior had absolutely nothing to do with this illegal way that he was using or abusing ketamine, which is so outside of and different from the way that it's utilized therapeutically and clinically that there's no comparison at all. But people started making that link, and then of course we had patients and prospective patients who were worried that this wasn't safe and maybe not something that they should go forward with, which is really sad because there's already enough fear and confusion around these more innovative progressive treatments as it is. And earlier you mentioned some of your more conspiracy theory mind thoughts about why psychedelics kind of disappeared for so long, maybe because it wasn't profitable for pharma. Well, that's why ketamine isn't more widely utilized, because it's a cheap generic drug. It was synthesized in the 60s, FDA approved in the 70s, so the patent is up. It's cheap, generic, it's made by a bunch of different people. And so there's no one pharmaceutical company that's going to make money on the sale of ketamine, or very much money, I should say. And so they market and promote their drugs that are high margin, name brand drugs, where they can market to doctors and say, you should prescribe this, it's good. And they market it on TV and tell patients, you should take this, it's good, because they want to make money on it. But ketamine doesn't have a big, rich advocate for it like that. And it's off label. So insurance won't pay for it because it's being used in a way other than what it was originally approved for. And insurance companies are not in the business of keeping you healthy. They're in the business of aggregating money and not writing checks. And so they'll look for any reason not to cover care. And they'll say, well, it's experimental or investigational, and we're not paying for that. But that's not really accurate. There's hundreds and hundreds, maybe even over 1,000 studies at this point proving ketamine as a safe and effective treatment for depression. But it doesn't have an FDA approval for that use. It has an FDA approval as an anesthetic. So these are where some of the politics and the money and the control get into our healthcare system in the US that people really need to understand. And this isn't conspiracy stuff. This is real life, how the system is built. And so this is keeping ketamine from proliferating even more. Now the silver lining is it's so extremely effective and it's so safe that it's just becoming more and more mainstream because you just can't ignore or keep down the truth forever. But it would be so much more widely available and more mainstream if a company had more ownership of it and really advocated for it in a way that was to their benefit. And unfortunately, that's just not really the case. And so it also gets really passed over a lot in an unfair way, unfair really to the patients who need it and could benefit from it. Where people are like, well, I'm excited about psilocybin or MDMA or this novel compound that's being created, because the people who are making this stuff or getting the stuff approved stand really to benefit and profit from it hugely. And so they have the machine running around the press and the marketing and the advertising and all the things that, and they're lobbying Congress, and they're making friends with the insurance companies and making sure they pay good rates for the reimbursements for their drug, and all the things that are going on behind the scenes that make the difference between what Americans and beyond are able to access when they need medicine.
Aside from the maybe conspiratorial parts, which it's not even that much of a conspiracy. It's like we all know that that's what's going on behind the scenes as pharmaceutical companies. They're not interested in things they can't profit from. But is the FDA kind of like the key component to why this isn't available as an insurance covered treatment?
I'd say that's the biggest obstacle. Yeah. And, you know, it's a little bit, it's complicated, but it would definitely help a lot if it was FDA approved for mental health. The problem is it costs tens of millions, if not hundreds of millions, to get a drug approved for an indication. I mean, really, the average actually for a new drug is $1 billion with a B from
Wow.
idea to approval. But even a drug like this that already has approval, where you're adding an additional indication, it would be at least tens, if not hundreds, probably of millions of dollars and years of doing all this stuff that per their standards. There's so much data and research out there. Someone maybe could get a little further along with a meta-analysis or something like that. I'm not an expert in that area, but FDA has very particular requirements that need to be met, and it's for their approval process. And so no one, it would be a philanthropic endeavor. No one is going to foot that bill because no one's going to make their money back. So it would have to be a foundation or some billionaire or someone who said, I want to do this for the benefit of mankind, not because I'm going to make a lot of money or a good ROI on it. And so far that person hasn't, or people haven't stepped forward in that way. That being said, insurance companies do pay for a lot of off-label stuff already. So it's not out of the question. And they also are in the business of making money, not spending money. And so ketamine is more effective and less expensive than other things they're already paying for. So in theory, an insurance company could say, well, there's enough data out there, and instead of spending $30,000 on a course of ECT for someone with treatment-resistant depression, we would rather spend $5,000 on a course of ketamine, which has a better side effects, more favorable side effects profile, and actually works more quickly and more safely. And in a head-to-head study was actually deemed as non-inferior, but in reality, it was actually superior. And we're gonna start to do that a little bit more. They could do that, but a lot of politics, a lot of red tape, and it's complicated.
So without the
FDA
insurance,
approval would help.
oh yeah, it's true. But when you say it like that, who's going to pay for the research and going through that, it makes it a little upsetting to think how long, if ever, that kind of thing can take. So for someone who is going to commit to paying for it out of pocket and their insurance isn't going to help? What are they looking at spending?
Good question. Yeah, I just want to add one more thing. I mean, earlier you said, well, obviously, big pharma is just in it for the money or whatever. But I think like most people kind of know that, but I don't think people realize the extent of how deep it goes, even through FDA and other regulatory agencies, in that we don't get what's best. And I think people are starting to wake up to this, but they don't fully appreciate how deep it goes in our healthcare system. And I think a lot of people still have this understanding that what's good is what's done, or what's best for us is what's made available to us. And that's definitely not the case. And it's really unfortunate. It would be really nice if the best, most effective treatments were what we had. But in the mainstream, system wide, that's not how it works at all. So yeah, as far as cost goes, it's at my clinic, it's $3,600 for a full course of infusions. It's $600 for each infusion. We do 6 over a couple weeks. They are, you kind of pay as you go, so you're not like locked in. You do need to do the full course for maximum efficacy and durability. We don't force anyone to. If someone has a couple or a few and they just hate it or they don't want to continue, whatever, they don't have to. It's very, very rare. We wouldn't just schedule someone for just 1 or 2, though. They need to commit to this series. It's important, just like with anything, that you give it a proper chance to work for you. And it does take at least 2 or 3 infusions, usually, before people start to see a benefit. It's possible that they could feel amazing after just the first one, and that does happen, but that's not what you should expect. And usually it's within a day of the second or third, people start to really notice a difference. We also offer the psychiatric evaluation, preparation, and integration, all covered by insurance. We accept most health insurance, most private, PPOs, and Medicare. So that helps to offset out-of-pocket costs, and we have that eval to make sure that people are a good fit and answer additional questions, free consultation, preparation session to really prepare them for the experience and set intentions and goals, integration to process what's come up for them during it, wraparound care and support, how they might want to make changes to their life based on the insights they get during treatment. And and then we offer, psychiatry as well. So your more conventional medication management, telehealth and in person, and also TMS therapy, which is another really great intervention that we have. Those are all covered by insurance. So the only thing that people are paying out of pocket for are the actual infusions themselves.
Has there been a particular case that you've seen a patient who really turned around in a way that stuck out for you?
Yeah, I mean, we've had so many. It's like the majority have been just incredible stories. We have a woman who's shared a lot about her story, who had really severe debilitating depression. She's an opera singer. She wasn't able to perform. She's a mother, wife, and just really became non-functional and unable to really be there for her family, no longer able to perform, really severe depression, and tried pretty much every medication out there. Had also had TMS and ECT, which is, electroconvulsive therapy or shock treatment. Had many rounds of that, lost her short-term memory, forgot how to sign her own name, really got very little to no benefit from any of the things that she had tried, and just as a really, really tough case. And after her very first infusion, had these negative thoughts and negative self-talk that she imagined, this Disney character just kind of flicking away and literally knocking all this negativity away. And she said those thoughts have not come back since. She's had many infusions with us over the years since then, probably 20. I mean, she's been coming to us for years. Because after the initial series, people do come back for follow-up, for maintenance. We call them boosters, on an as-needed basis. And that might be once every 3 months or every 6 months, or, it just depends. But she's been coming to us for years and has started her own opera company, is performing again, is producing and directing shows and promoting them, runs her own business. I mean, she's like high functioning, great mother, great wife, with her family, helping her take care of things for her father, and is just an all around like superstar, and to have gone from so severely debilitated by her depression, it was so treatment refractory, it was so not benefiting from anything that she had tried, and she had tried just about everything out there, for her to then have IV infusions of ketamine with us and to have her life really truly transformed by it is just super inspiring. And she's really sweet and really smart and really articulate, and also understands the treatment really well, in addition to having really benefited from it. So I just think she's a total inspiration, and just so grateful to be able to be a part of supporting people like her. And it's why I do what I do. I mean, it's just the coolest thing ever. There's no, like, what greater feeling is there than someone literally saying like, so many of the great things in my life are a result of the work that you're doing, and I tell her all the time, like, she's the one who did the work. She showed up, she never gave up hope. She's got to go and show up to her life every day still, because it's an ongoing thing, and to continue to take good care of herself. But in our own little way, we're able to be part of that healing for her, is just the coolest thing ever. So, and that's just one of literally thousands, no exaggeration, thousands of stories of people having total transformation in family, work, school, their health, physical, mental, just like it's the best part of this. So it's really what it's all about. So
I've seen it. I can speak to the transformations and just what I anecdotally have witnessed. So, what's next for ketamine therapy?
for ketamine therapy, I think it'll continue to become more widely available. I hope with the right places, and who are doing it with integrity, because there's important differences between the places that are offering it. And I think we'll continue to see different applications in different settings and environments, and it becoming more mainstream, so whether it's more like clinics to retreats to like individual one-on-one to groups, like it'll just continue to evolve in all these different ways that people can have access. And it's already really paved the way, and I think will continue to pave the way for other psychedelic medicines to kind of follow within the model that's been working for IV ketamine. And as a clinic, we are excited to incorporate other psychedelics as they're legally available, to bring in more awareness of the other services that we offer as well, because we do offer other services, and just to help more people, and then ultimately to open up other locations. So we have one location in Culver City in Los Angeles. It's 5,000 square feet. We have 13 employees, psychiatrists, psych NPs, RNs, admin support staff, and we're excited to just continue to deliver, really high quality care here and help more people, and then ultimately replicate it in other locations. So yeah, that's kind of what's, I think, up for ketamine and also for us as a company.
That's so cool. Well, thank you for an incredibly insightful conversation. If people want to learn more about what you're doing in your clinic, where should they go?
Yeah, thank you for having me. This has been fun, and lots of great information on our website, ketamineclinics.com. That's KETAMINECLINICS.com. And we offer free consultations, lots of great info on there. I would encourage anyone, to reach out, and we're always happy to speak with you and see if we can help.
That's so cool. Oh, I forgot to show you. This never happened, but my shirt says Ketamine Art Club, but the lighting is bad.
Oh, I just
My
I
friend was
just see
like
that
trying to
now.
make an art club, and then it never happened, but she made the t-shirts and I got one, and I was like, what a perfect time to wear it.
Oh, that's awesome.
Yeah.
That's great. I love that.
Well, thank
Yeah.
you so much for talking to me today.
Yeah, thank you so much for having me. It was great. Really appreciate it.
Of course. And thank you so much, everybody, for listening. Bye. If you know somebody that would enjoy this episode, feel free to share it with them. And thank you for listening to Galina Ravina Podcastina, the show where I try to be the person my dog thinks I am. Don't forget to hit that subscribe button so you never miss an episode. See you on the next one.